So what brings me in today is I am a bad golfer, and I sometimes when I swing hit the dirt with my club, and it's really sore in here in my forearm right now, and I am here for chiropractic treatment, but also based on Dr. Schwabe's recommendation, we're going to try the shockwave therapy out, which will be my first time doing that, and so we'll see how it goes. I'm optimistic.
We have two machines here. This is radial shockwave. So this is a pressure wave, actually. There's a little projectile and it's air compressed, and it just shoots this little projectile in here, which stays, it hits along here, and it creates a sound wave out from the device. We can change out these little end pieces for different intensity or different areas of the body. Sound wave comes out kind of like a flashlight. It has the best effect at more surface level areas. So muscles and tendons and trigger points, it gets about 2 inches depth into the tissue. So here's what it sounds like. It sounds a little scarier than it is. I'm just gonna put it on your thigh so that you can feel that. Yeah, it's sending that sound wave in and it's going out into your tissue, right? And there may have been a little trigger point there, and your quads go into your knee. So then attach down there. We're gonna turn that intensity down for your arm though. This one is what we would call a true shockwave, like a lightning strike or an airplane breaks the sound barrier. It is created by electromagnetic energy, but when the shockwave comes out from here, it actually comes out to a very specific point. So it looks like an hourglass. It comes to a point and then it goes back out. So we'll put this piece on it, which then makes our focus point at about 1.5 inches. And then it goes back out. So you get covering everything you want, but it's very specific and it's quieter. This one travels at about 1,500 meters per second. This radial pressure wave travels at about 10 meters per second. And that's what each little click is a quick high pulse. It might feel a little needly kind of, although there's no needles involved. And we'll start really low intensity and we work with your intensity. 5 out of 10, 6 out of 10 max, that's kind of what we're looking for this. Okay. We'll start with this pressure wave. Little ultrasound gel helps us transmit both of those. And you said it's more along this side than the other side, correct? Yes. Okay, here we go. You feeling it?
Yeah, I especially felt it
as I go up higher.
Oh, yeah.
Yeah. So, and closer to your bone there too. So, is that too much?
Oh, no, it's just so.
It's a weird feeling, isn't it?
Weird,
yeah. So, because this one is not like a laser beam, it's a flashlight, we can move it around because we're still hitting all that tissue. So that'll help you take the intensity of it. Are you doing okay with that intensity?
Yeah.
Okay.
I'm definitely already curious over acupuncture needles.
Yeah. I mean, a lot of us don't like needles, right? So this is helpful there. Okay, so because this is Amy's little body and how tender you are in there right now, I'm gonna use a different transmitter tip even. Okay, how's that one?
I mean, it's
a little less intense?
Me, yeah.
Yeah, number?
Oh, I don't know, maybe like 2 or 3.
Okay. Is that calming down at all or is it about the same?
All right, I feel normal now, actually.
Okay.
Yeah. That's crazy. Already.
Yeah, this sends it up quite a bit.
Wow.
Does that feel
I've been
different?
trying to do the stretches that you were going to tell me to do like this.
Yeah.
But that's significant.
Okay. So now we're going to go with the true shockwave, which was focused shockwave. You'll also see this called extracorporeal shockwave therapy, or ESWT. So this one, because it's a very focused wave pulse, you're not going to feel it radiating out like the other one. When I get on a spot, you will feel it, and you will feel maybe some achiness, but I'm gonna start at the very lowest level.
Oh yeah, there it is. Whoa.
Okay, is that too much?
No.
Okay, it's just weird, right?
Like the weirdest, yeah.
Okay. Can you feel this one now?
Oh yeah.
Okay, is that the right spot? Is that a good spot? Is that an intense sort of like a
Yes.
painful spot?
Yep.
Okay, give me a number. What number are you at?
For pain?
Yeah.
To
Okay.
remake with that.
Okay. These muscles also get really tight in carpal tunnel, and sometimes people think they have carpal tunnel, and it's really just about releasing a lot of these muscles.
There's a spot.
Yeah, so this whole area where the muscles are coming in and attaching to the bone. It's a little angry. It's been strained, you know, it's been overused a bit. It's a little bit of intensity, right? When you hit that ground, it's a trauma to that area. You take a lot of force into that space. And that's all a strain is. A strain is a little aggravation, little micro tears, sometimes more than a micro tear to the tendon, which is where the muscle comes in and attaches to the bone. Between the muscle and the bone is the tendon. You also have ligaments in this area. You okay, hanging in?
Yeah.
Okay. It's reaching where my hands can't reach.
Yeah.
And with this one, we stay static when we find a good spot for a couple hundred pulses, because it's such a focused point to the wave that if we move, we'll be off of it. So we stay static, whereas before we could sort of move the transmitter tip around. This one, we like to stay right where we are. Tell me, was that painful or just kind of a zingy? Okay.
Yeah, like unexpected.
Yeah. We had a lot happening in here, so let's just check. So we're sort of scanning with this focus. Next time you come in too, you'll know it's always, the first appointment is always interesting because nobody knows what to expect because they've never received this before. And it's different than a lot of other treatments. All right, Amy, let me wipe that off for you. We ask that you don't use any ice today and no ibuprofen or NSAIDs of any kind like Aleve or that sort of thing. If you had pain and you wanted to take something, you can put CBD salve on it. You can put arnica on it. Those are like natural inflammation modulators. And so that's okay because it doesn't stop. What an NSAID does or an ibuprofen does is it cuts off that inflammatory process. And we're actually using that inflammatory process in a positive way here because with our body's natural response to bring all the healing biochemicals and things like that into this area, that comes with a little extra blood flow and a little bit of inflammation. But it's local, right? And so we want that process to continue. You don't want to cut it off and have it stop completely. You can use a little heat on there if it's sore, and you can use Tylenol or natural supporters of our immune and inflammatory process. So arnica, CBD, turmeric, curcumin, if you take any of that, sometimes omega-3s, that's all fine. How does it feel?
Less sore, actually.
That's it.
Yeah, for sure.
How does the mobility feel? Does that feel the same or different? Or the range of motion?
It's better.
Okay. It's not uncommon that you'd feel a little bit sore and you might feel a little more, like you said, right in that spot where we just worked where it's really tender. We typically recommend 1 to 2 times a week for people who are generally very healthy, but once a week is a good goal for treatment. And for something like this, that's a little more acute. And also we know from our own experience with treatment and also the research that's out there that this heals quite quickly. So for treatment plan would be great for this issue. And then we'll go ahead and adjust you and adjust your shoulder, your elbow, your hands, the rest of you that we've got going on here, including your neck. And that will all obviously help as well.